We not only specialise in hair transplantation, but we also specialise in giving you the correct advice based on your specific hair loss concern. Everybody has questions, and today we're in beautiful Sydney Harbour to answer some.
I guess I'm asking the obvious question, but is the surgery painful?
Many people who approach us state that the surgery is the scariest part of what we do, and they often admit that that's the main reason they don't go ahead with the procedure, because of the fear of the pain. I can advise that we did conduct a survey, and the survey showed that 97% of the people that had a transplant said they would be less apprehensive about the pain if they ever were to have the procedure again. Each year we hold a number of seminars where we bring a few previous hair transplant patients. The seminar allows people such as yourself to ask them questions directly about their experiences and to put your fears to rest about the pain associated with the hair transplant procedure.
How do I know if hair transplants are right for me?
The best way obviously is to come in and see us. If you are after a permanent solution to hair loss, hair transplantation is the answer. There are many short-term solutions in the hair loss industry, but hair transplantation is the only permanent one. My best advice would be to come in for a consultation so that we can advise you specifically what is the best course of treatment for you.
What can you do for women that are losing their hair?
Women generally lose their hair in a different manner than do males. Men generally lose hair from the front and their hairline recedes backward over time, where women lose it in a diffuse fashion throughout the mid-scalp and crown regions. Hair loss is a lot more devastating to females because it is less common and generally less culturally acceptable. This of course can lead to a massive loss in self-confidence. Females are becoming a bigger part of our business. We do offer the latest techniques available to help thicken up thinning regions, as well as to minimise damage to the surrounding hair.
I've seen a lot of hair transplants and they just look a bit obvious.
And so have many others. Over the last 30 years, hair transplantation has evolved a long way. What you're thinking of is what was known as punch grafts, which are 4mm grafts holding 15 to 20 hairs each. And over the last 30 years, hair transplantation has evolved. After punch grafts came mini grafts, followed by micrografts, where now the best form of transplantation available and the smallest graft possible is the follicular unit graft. The follicular unit graft is the smallest possible graft, and that's because they are dissected under the microscope where excess skin is trimmed off, making them much thinner than any of the grafts of the past. Because of the smallness of the follicular unit graft, this allows much better density than was ever possible before and a natural looking hairline. So the obvious doll's hair look that you're thinking of, or rose of corn as some call it, is old technology which existed 20-30 years ago, which unfortunately was the best thing around back then, but not anymore.
What if I want to avoid having a scar on the back of my head?
When a strip of skin is taken out from the back of the head, the area is closed with a method known as the trichophytic closure. This closure method allows some hairs to actually grow through the linear scar that's created at the back of the head, therefore camouflaging visibility of the scar. Hair transplant patients generally can cut their hair to a number 3 or number 4 clipper, which is on average about a 10mm length, which is still quite short. For the people who want to wear their hair shorter than a number 3 clipper, we do offer a transplantation method known as follicular unit extraction. The difference between that method is that there is no strip cutout like follicular unit grafting. Follicular units are extracted one at a time from the back of the head, and because they're extracted individually, you don't end up with a linear scar. And no linear scar means you can still shave your head very short without any obvious scarring being visible.
How soon after the procedure can I return to work?
Well, that all depends on the patient and what they do for a living. Some people can return to work within a couple of days, but generally, if you're sensitive about your appearance, which most people are, we normally recommend a time frame of 1 to 2 weeks off work.
If I have a hair transplant, then won't the transplanted hair fall out just like my old hair did?
I can reassure you the answer is no. You have to remember that the transplanted hairs are extracted from the back and sides of the scalp, which are resistant to the effects of DHT. When we transplant these to the top of the scalp, it doesn't matter where they are placed, they are resistant to the hair loss effects of that hormone. For that reason, most of them will never fall out. So therefore, what you're paying for is a permanent option.
I've heard that it's a significant investment. How does a hair transplant compare to other hair loss treatments?
When you compare other hair loss treatments, which are to take a tablet, use a lotion, or wear a wig, those 3 have ongoing costs. What separates hair transplantation from the other 3 is that there are no ongoing costs for hair transplantation. What you're paying for is permanent, and you know that most of those hairs will still be on your head in 10-20 years' time. All those other options cost over time and prove to be more expensive in the long term. And for that reason, hair transplantation is the most cost-effective hair loss treatment in the long term. To find out more about hair transplantation, call the team at the National Hair Institute and we'll be happy to arrange a consultation for you.